So I will discuss some rubrics of constitutions with their remedies and their prominent indications. So you can keep your book aside and please note down the remedies or the key symptoms what I am here to speak. So first rubric, adipose tissue increased. So if a patient have a constitution of adipose tissue increased, think of the remedies calcarea, capsicum, ferrum, graphitis, and phytolacca. Now we'll end up what to be given in that remedy, right? So that is what I say. Repertory is not always a final court of judge. Materiamedica is the final court for selecting the right remedy, selecting the right judgment. Now here we have four remedies. Now, which remedy to be given if a patient has this adipose tissue increased? How to confirm how to confirm his capsicum, graphitis, or phytolacca? That is prominent. That is where your materiamedical knowledge comes into role of play. To confirm his calcarea, see the constitution, fat and fabby, desires egg, perspiration on the head is calcarea. Capsicum, more of burning nature, burning presenting complaints, along with homesickness can be capsicum. Ferrum, anemic state of persons, dread of downward motion is ferrum. Right? Graphitis, more of skin prone symptoms in the past history, and they have a lot of trifles. I can give you a small example like how graphitis patient will have a conversation between a wife and a husband, right? Husband is staying at the office and some neighbor has have a fight with this wife, then immediately this graphitis lady or graphitis wife call to the husband and says, husband, hey, kya hua, ye hua, oh, neighbor aaya, ghar pe aaya, oh, something has happened. So they discuss each and every minute trifles to some other. Trifles aggravates. The turmoil of graphitis is so much, emotional turmoil of graphitis is so marked. So that's why graphitis is in the rubric minute slightest trifles aggravates. That is graphitis. Coming into phytolacca. Phytolacca is more of a remedy where you can think in breast cancer, breast mammalae, where the tumors of two hard tumors. Along with phytolacca, you DD with conium, philandrium, and chelidonium. These are the remedies to be DD'd with breast mammalae. And phytolacca tonsillitis is extend to the ear. Recently, I done a case with phytolacca and he was very well after just within 2 days. The main complaint is throat complaints, the throat tonsillitis extending into ear is phytolacca. Next rubric, adipose tissue increased children in is calcarea, as I discussed it, right? Adipose tissue increased removes pathological deposits of fatty matter. The remedy is calibrome. So how to confirm calibrome? The main clinical tip of calibrome is can be used in acne, acne rosacea, severe acne pimples. Calibrome is the top remedy. Along with that, you DD with Eugenia gembones. And all these calibromatum or cali remedies have the quarrelsome between families. There is a lot of quarrelsome between bread and butter. That is Kali family. Now coming into alcoholic constitutions. So alcoholic patients come into your clinic. Try to keep these remedies in your mind. That is ars, china, lachesis, naxomica, opium, ranunculus bulbosa. Ranunculus bulbosa is one of the remedy in intercostal rheumatism given by Allens. If you read Allens, there is the word that is intercostal rheumatism is ranunculus bulbosa. Selenium, sulfur, sulfuric acid. And remember, sulfuric acid is the remedy, one of the only remedy in materiamedica, which is so much hostiest remedy, so much restless remedy is sulfuric acid. So coming into next rubric, alcoholic constitutions with diarrhea is lachesis. So everyone know the confirmatory of lachesis, tight clothing aggravates, jealous, suspicious, keep the tongue always out like a snake. That is the prominent confirmatory of lachesis. Alcoholic constitutions, dyspepsia and debility is naxomica. Naxomica constitution, irritability, anger. The main rubric to understand naxomica is delusion bed is sold by someone. That means they feel That means they feel that someone is occupying their place. That's why Naxomika people are so much ambitious to achieve something. That is the prominent rubric. That is the prominent rubric of Naxomika. Right. Now, coming to next, alcoholic constitutions, hand trembling. That is Naxomika as well, with trembling. If there is a trembling with lot of anger, can be staphysagria there. So this is how, if some word has been you read in your materiamedica, you just did it with some other remedies. That is how materiamedica is studied. Alcoholic constitutions with headache, that is agaricus muscularis, a fungal remedy. Alcoholic constitutions with liver enlargement is Naxomika. Liver pathology with history of alcoholism can be Naxomika. Match with other totalities of symptoms as well. Alcoholic constitutions with paralysis, the remedy is opium. There is lot of sleeplessness, lot of painlessness characters can be opium. This is how you need to differentiate. Now coming into anemic constitution. In anemic constitution, what are the remedies we have? Calcarea pos, China, ferrum pos, and nitrum mure. There are some other remedies as well, but these are the prominent remedies can be thought of. Now, anemic constitution with debilitated rheumatism and scrofulous children afflicted with ascarites and lumbago, that the two remedies are China and Spigelia. Sina and Spigelia, sorry. So they have that worm infestations with anemic constitution, lot of debility, scrofulous children. At this constitution, you can think of these two remedies, Sina and Spigelia. Anemic constitution, fluids or vitality loss of China and Kalikab. We know China is the remedy for loss of vital fluids, right? Along with that, Kalikab is one of the remedy. And remember Kalikab, if a patient who comes and tells I am never well since with pneumonia, and if there is any family history of pneumonia, and patient have developed asthmatic problems, bending forward amel is Kalikab. If a patient comes in front of you, just he bends forward, then the patient feels I am feeling better, then Kalikab. And as I said, there is a lot of quarrelsome can be seen in Kalikab. Along with carbon group, that is they want a lot of dependent nature. They want a lot of that love, care, affection from the carbon group and from the Kali group, that is phosphorus group. This is how you need to interlink. Next, coming to asthmatic constitutions. Coming to asthmatic constitution, bilious, the only remedy is phosphorus. So phosphorus patients suffer with asthmatic constitutions having bilious temperament is phosphorus. And how a phosphorus patient will be? He's very tall, lean person, desires for cold drinks, desire for ice creams, desire for that love, care, affection. That sympathetic nature of phosphorus can be seen. Right. And all phosphorus patient cannot lie on left side. Left side aggravates. They cannot sleep on left side. You just confirm before giving phosphorus. These are some confirmatory indications what I am telling you. You can cross reference, you can cross question with your patient when you are thinking he is phosphorus or some other remedy. Coming to bilious constitutions, Bryonia, Cadmus marnus, Chelidonium, China, Naxomica, and Podophyllum. So these are top remedies actually in bilious constitutions. More of Cadmus marnus with jaundice like heart affections, bilious symptoms, liver symptoms with heart affections can be seen in Cadmus marnus. Chelidonium as well, but Chelidonium pains will extend to right scapula. That is the prominent indication of Chelidonium. And if the patient is Chelidonium and you have prescribed Chelidonium, but still it fails, that very equivalent remedy to Chelidonium is Bloda fragrans. That remedy comes very close to Chelidonium. Next, China, as I said, Naxomica, Podophyllum. The most prominent confirmatory of Podophyllum is if a patient comes near you having abdominal complaints or liver complaints, and if they just rub like this, they say, doctor, aise kare to I feel better. Rubbing amel on the liver parts or on abdominal affection is Podophyllum. The other remedy with Podo is cyclamine. Right. Bilious constitutions, Constipation tendency 2 is Naxomica. Next, cancerous constitutions, the malignant growth. What are the remedies we can think of? Carcinosin, cadmium sulf, conium, and hydrostis. Right. Cadmium sulf. Remember this remedy? This remedy can be used if a patient who has undergone lot of chemos, lot of radiotherapy, lot of chemotherapy, then they develop lot of weakness, lot of debility. You can think of cadmium sulf. Elements of the chemotherapy is cadmium sulf, but the prominent modality to prescribe, or the prominent key modality to prescribe cadmium sulf is the patient has to be have vomiting sensation with the debility. Blackish vomiting is cadmium sulf. Conium, we all know, more of glandular remedy. Hydrostis is same. Next, coming into Catarrhal constitutions, the inflammation of mucous membrane of head and throat. These are the prominent acutes we see, right? That is Hepar sulf, Calibi, Medorinum, Nitramur, Pulsatilla, and Thuja. So Hepar sulf. If a patient having these catarrhal cold cough with any throat scratching irritation, you can think of Hepar sulf. But confirm the patient is Hepar sulf or not. Hepar sulf patients are so much irritable. They have the desire to kill someone. They keep everything, every matter to have that kill to desire. Keep everything on fire. That is Hepar sulf. They are not mild like Pulsatilla. Calibi, the sticky discharge, you can think. When there is a lot of sticky discharge, Calibi can come into role. The nosode is Medo. Other one, Nitramur, we all know. Pulsatilla and Thuja. Coming to children constitutions. So how to identify the children constitutions, right? Calcarea, Calipos, Phosphorus, Pulsatilla. And if in children constitutions, if they are chubby, think of Calcarea. And in children constitutions, the cold is readily taken. They are having recurrent colds, can be Calcarea carb. They are very much fat and flabby, can be Calcarea carb. If they have a lot of growing pains, can be Calipos. With these general constitutions. General constitutions with nervous weakness, umbragrasia and anacardia. Children constitutions overfed, sickle core. Children constitutions self-willed, that is Calcarea, Calipos, and tuberculinum. Right. Tuberculinum can be given as an intercurrent if parent or a patient or his mother and father says, doctor, my child is suffering from recurrent illness from childhood, since childhood. Give tuberculinum intercurrent with your constitutional medicine, because tuberculinum has that illness since childhood. So coming into the complex general, like how we can see a patient by looking at them, how we confirm is so and so remedy, right? If the patient is so much of dark and burnet, think of causticum, ignitia, kalicarb, nitric acid, phosphorus, and rustox. We all know causticum is more of cared, worried nature, more of anxious nature, more of sympathetic nature can be causticum. Now here, causticum, phosphorus, nitric acid. Interestingly, all these three remedies are high grade in sympathetic nature of homeopathic literature, or I can say homeopathic remedies. Now, how to differentiate how causticum is sympathetic, why causticum is sympathetic, why phosphorus is that much anxious, and why phosphorus is sympathetic, right? Nitric acid as well. See, phosphorus want the genuine affection, the genuine sympathy is phosphorus, right? Causticum is not like that. Causticum wants someone to have that affection so that causticum will be safe and secure. But nitric acid is sympathetic as well. But if nitric acid, someone has betrayed nitric acid, he will take revengeful like anything. That is nitric acid. They want that support to have someone for them if he is in an extreme stage, the extreme stage of revengeful. That's why nitric acid have that cunning nature of sympathetic, I can say. So ignitia, right? Ignitia is grief, which comes very close to nitramur. And nitramur is prolonged chronic grief is nitramur. If there is any short grief, you can think of ignitia and DD with some confirmatory symptoms. Coming to fair, bold, light, the remedies are calcarea, petroleum, phosphorus, pulsatilla, and spongia. Coming to dwarf constitutions, one is Barretta cup, we all know, Calcareopos, Medorinum, Silicia, and sulfur. How to confirm Silicia, right? The other remedies will be coming in the next. So to confirm Silicia patient, you just ask them, do you have any stage fear? Do you have fear of examinations? Does their complex look like any having skin symptoms? Acne, pimple, blackish discoloration can be Silicia. And the prominent confirmatory of Silicia having perspiration in the feet and the soles. That the cold perspiration, if you find in the soles and the feet, it is Silicia. Right. Coming to emaciated constitutions. What are the emaciated constitutions with the materiamedica remedies? Ars, hydrostis, iodum. We all know, interestingly, iodum is a remedy for glandular pathology, you know. But at one stage, iodum will be hypertrophy. But when iodum enters into the syphilitic state of iodum nature, there will be, you can see there is a lot of atrophy in the nature. So that's why in emaciated constitutions, iodum is the top remedy to be think of. That is what nitric acid and silicia. Chronic disease with deep-seated progressive is lycopodium. Chronic calls, chronic complaints. I can say lycopodium is a neglected pneumonia. If a patient suffers with lot of pneumonia, lot of upper respiratory tract infections, seeing so many chronic years, lyco can be given based on totality. Neglected pneumonia is lycopodium. That is why lycopodium is so much deep acting remedy. Cough with, right, with emaciated constitutions having cough, chronic cough can be nitric acid. Emaciated constitutions having debility and emaciation, as I said, that is iodum. Emaciated constitutions with weakened by loss of blood is chinum sulf. And interestingly, chininium sulf have diarrhea after eating egg. If a patient complains after eating egg having diarrhea, blindly prescribe chininium sulf in low potency. So coming into the constitutions of infant constitutions, how we can see the infantile patients who come to our clinic. So what are the remedies to be thought of? In infantile asphyxia, the top three remedies are night antium tot, campfire, and laurocirrhosis. To prescribe antium tot, try to examine the patient. If while your examination you find there is a lot of wheezing, rattling, antium tot will for sure work for the patient. That is the key confirm. Antium tot has that wheezing and rattling. Campfire, coldness of extremities can be seen. Laurocirrhosis is more of constricted kind of remedy, more of heart pathology, more of respiratory, and laurocirrhosis. Infantile constitutions with Catarrhal effects is calcarea. Infantile constitutions with colic, that is chamomilla and naxomica. You know, whenever you read Fatak, Fatak has written one line in chamomilla. Chamomilla is called opium of homeopathy. They are more of irritable, more of painless character is chamomilla. Infantile constipation, the remedies are alumina, bryonia, calcarea, opium, and nitramur. So everyone knows that, right? Infantile constitutions in diarrhea can be podophyllum. Infantile constitutions with face like an old man, the remedy is syphilinum. And remember, my dear doctors, this is very important. Whenever a patient who comes with congenital effects, congenital disorders, try to keep syphilinum as an intercurrent remedy. In any congenital effect, syphilinum will work. That is what this rubric tells, right? In an infant, how the infant baby will look like an old man, right? That is the congenital effect by birth. So that's why syphilinum is indicated. If a patient comes whose ear, one is large and one is very thin, can be syphilinum because of congenital effect. This is how you need to thought process immediately whenever you get a patient, not just ending into taking repertorization, converting the rubrics into symptoms or symptoms into rubrics. That is not at all important. First, see the patient, see the constitution. Who is he in front of you? What was the constitution? His anger, mild, how he is, how he is in your clinic, his eye movement, his restlessness nature, his body movements, each and everything is important. How he walk, how he sit in the chair, that you need to understand. Not just ending into taking the symptoms, converting into the rubrics, and finalizing some xyz remedy. Never help, never help. Try to find out the patient, who is he in front of you. That is important as a homeopath. Coming into jaundice in infants, aconite, chelidonium, and murk. Infant constitutions with sore child smells is rheum. Along with this remedy, remember Sanancula, Macab, and Ethusa. But room baby, you know how to identify room baby. Whenever a room child enter into your cabin,